An Oklahoma nonprofit is already looking ahead to next legislative session in an effort to get lawmakers to remove barriers for health care. Susan G. Komen is supporting a bill that would fully cover genetic testing for people with a family history of breast cancer. I talked with a woman who had preventative surgery because of that testing and explained why she says it was a gift. Family time is crucial for Tulsa mom Jen Kirchhoff.
They dance in the 9:30, the 11:30.
Whether going over schedules in the kitchen,
Did you guys do math today when I was at work?
or catching up with her twins over cards, her family means everything to her.
I thought, it is something that if I can make this investment in my life and time now and I have that opportunity, I don't want to pass it up so I have more, endless time with my family.
Family was top of mind for Jen when she first started having problems 2 years ago. Doctors found cysts in her breast that just kept coming back. She had mammograms, biopsies, scans, MRIs. It wasn't cancer, but it was a big enough concern that her doctors recommended genetic testing.
For me, I met a lot of that criteria just due to the cells that they kept finding and all of the issues that were occurring, and then also having a family history.
That's when her confusing health picture became crystal clear. She tested positive for the PALB2 gene mutation.
That specific one impacts your chances for ovarian cancer, breast cancer, and pancreatic cancer. Really wanted to know all of my options now that I knew that I had that mutation and would be something that would be carried with me the rest of my life.
After months of research and doctor's visits, she decided on a preventative full hysterectomy and double mastectomy and surgery with Dr. Lori Flynn.
Being a breast surgeon isn't just about the operation, but it's about getting to the right operation for the person.
Dr. Flynn says for many women who don't currently have cancer but may have a mutation, the genetic testing and counseling can be crucial in their path to health.
Individuals who have DNA mutations, they're more likely to have cancers develop between mammograms. It's just so lovely that we have a way to help these individuals, previvors, individuals who have a risk of cancer, but yet they do things about it to make them a previvor.
She doesn't push people into having a double mastectomy, but says the testing and counseling provides critical information that can be life-changing.
Here's your options. Now, this is what I recommend for you, but what do you think is right for you depending on these options?
It's the reason nonprofit Susan G. Komen is pushing to have this genetic testing more accessible for people with a family history of breast cancer or an increased risk of breast cancer here in Oklahoma.
It will change the trajectory of where these individuals' lives may be.
Oklahoma Executive Director Sherry Holdman tells me while their bill ran out of time this legislative session, they'll have it ready next session and hope it'll be signed into law.
So at this point, somebody would have to pay a copay or out of pocket with insurance, and you all are hoping that this bill would make it free with insurance.
Absolutely. Absolutely. So it removes that cost sharing opportunity, and it really allows this patient to get the answers, the care, and kind of that future determination that they know they need.
She says it would remove barriers and help save lives.
It puts that control and that autonomy back in the patient's hands.
Back at Jen's home, she says her surgeries were extensive and required 2 months downtime, but ultimately, the testing provided a gift to her and her family.
It was a couple months, but the long-term opportunity of health and happiness and love is absolutely priceless.
Depending on insurance, that testing could cost thousands of dollars out of pocket. It's why the nonprofit is fighting for this coverage.
Still to come.